I'll comment on several of our programs, particularly as they relate to food safety and food defense through the National Center for Food Protection and Defense at the University of Minnesota, are actively involved with our colleagues in Canada and Mexico on issues related to food contamination. Not so much through the Centers for Foreign Animal Disease and CZAD at Kansas State, although there are always concerns raised about these disease outbreaks in other countries around the world, and our NBIC, the National Biosurveillance Integration Center, does track those closely every day.
So, and I'm not going to be able to get into real specifics with you, but certainly through the different federal agencies, we have veterinarians that are involved in those agencies that have international roles. CDC, NIH has research, we focus on research not just in the U.S., but disease entities across the world. FDA for USDA, I mean, all of our federal agencies have an international piece to them, and I'm often surprised, delighted by the fact that we have veterinarians integrated into many, many facets of that, of those federal agencies and the roles that they play. Pretty much anything that involves public health, you can find a veterinarian involved in that. And again, it's such a wonderful thing about the diversity of the degree that we come out of our schools with.
From my standpoint, the American Association of Bovine Practitioners, swine veterinarians, poultry veterinarians, all of those species groups, we have experts in the fields, whether it's food safety, whether it's epidemiologists that go to international meetings that are highly sought after for being speakers at international meetings. We have international speakers come to the U.S. We are continuously collaborating. When there's a foreign animal disease outbreak in another part of the world, we're tracking that and looking to see what we can learn from that, how we can help deal with that, and how we can help prevent that here. So it's constant.
International activity, I'll give you two examples. One is our AVMA CEO, Dr. Ron DeHaven, is chairing a working group, as you may or may not know, with the World Organization of Animal Health to get consistent educational standards and competencies for around the world, because as you know, there are veterinary schools all over the world of varying degrees of education. Some of them are very mild 2-year programs, and some of them are much more complex programs. And so there's quite a variety if you have a doctor of veterinary medicine in whatever country you come from. The EU, of course, is dealing with this a lot. They have reciprocity between countries, and so there's a great interest in saying, look, if you're going to call yourself a veterinarian and be involved with transboundary diseases and infectious diseases, that you have these competencies, and we're trying to get those established around the world in all veterinary schools. It's a long process, but you can imagine there's a great deal of variability. The second thing is that I'm currently chair of a working group for the World Veterinary Association, and that group is looking at being the overall voice for veterinary medicine around the world, for veterinarians around the world. They have representatives from every country. They have a president's or general assembly with representatives from all member countries. And that is, I think, another step where we are very actively involved to make sure that the United States has a very respected and clear voice and influence in international issues of veterinary medicine and national security. So those are two examples I can give you, amongst many.
Anyone else? I know there are questions out there. Don't be shy. Go ahead, sir.
I'm Bob Gordon, a DVM MPH. Made the decision about 5 years ago, looking to the future, so to speak, in my ripe old age, that veterinary medicine needs to be involved in public health. There are many medical schools that provide for their students the dual degree of an MPH and an MD. I don't believe that that has been established within the veterinary academic community, that one can get those degrees simultaneously. But while that might be an option, I will say that one of my biggest concerns, and the reason I chose the program that I did, is that I live my life in veterinary medicine. Not that I dislike anyone in our profession. I think it's a great profession. But I learned more by being in an MPH program that had no other veterinarians in it, because truly One Health then came out. And I can't tell you how many times my classmates or my colleagues said, "Oh, I never knew veterinary medicine was involved with that. I never knew veterinarians did that." So if we want to elevate the status on the One Health level, we need to be active out in that environment. It'd be nice to have a DVM MPH program within our veterinary schools. But you know what? All we do is talk to other veterinarians. That doesn't do anything to raise the standard among our colleagues or among the public. The second thing, if I may, we heard many comments, and maybe this can go, we can revisit for a second, about the decision-making, whether it's through the AVMA principals or the bovine practitioners making decisions with antimicrobial use. No one addressed the issue about the fact that there are non-professionals, there are producers who have access to antibiotics and make these decisions from an economic standpoint and do not include and do not involve veterinarians. It's nice to stand here as a veterinary profession and say we should be the ones making these decisions. We think of it every day, as Dr. Navarro said, we focus on that, or the AVMA focuses on that. Then we need to establish the level within our profession of respect to saying no one other than a veterinarian prescribes the use of antibiotics.
Well, I work with producers on a daily basis, and I can tell you that they do care and they do make decisions not just based on economics. In fact, many times I will recommend something based on economics, and they will ignore me because that animal, even though it's a productive animal, has a name. And so that's a constant frustration because may not be the best thing for the financial stability of that farm, but they're making it because they they care about those animals. Again, quality assurance programs are out there. We can argue about over-the-counter drugs all you want, but the fact is those producers look for veterinary help. It's not always available. That's a whole nother issue. They do seek help wherever they can get it. I get calls on a daily basis from producers who have no access to a veterinarian but want to know what I would recommend. They don't want to do something until they actually have advice.
I just have, there's two subjects there, and I'll get to Andy because I know he's chomping at the bit to answer this question. The first one is on the antibiotic residues, and I will just tell you something going on in Wisconsin. What we have to do is work with producers. They're the producers of our food supply, and we are a team. Veterinary medicine and producers are a team. I agree that there are over-the-counter medications available, and there is always this concern of animal health and food residues. I will tell you in Wisconsin, I'm speaking from Wisconsin where I live, that we have a task force on residues that is making amazing progress in relationships with producers. So we have to make sure that we have this cooperative teamwork together, and it doesn't change overnight. The answer is not to take everything away carte blanche right now. That will have major issues. What we have to do is continue to improve the program and continue to have trust in these relationships, and I think we're making tremendous progress there for something that will be better rather than having bad effects from making knee-jerk reactions. The second issue that you had was dual programs, and I can tell you that I know there are several dual programs, whether they're DVM, MPH, DVM, MBA, DVM, PhD, and I maybe would ask if it's okay with Amber to have Dr. McCabe address that question if you want.